So today what we're going to do is we're going to go over a typical, for the most part, OBGYN exam. And what I'm going to do is I'm going to act like I am the doctor in one scenario, but also I'm going to have somebody volunteer to show me that they are the MA. Okay? So what I mean by that is you need to know not only your job duties here as the MA, handing whatever equipment or whatever supplies that the physician needs when they're doing a GYN exam, but also you need to know what their job is, okay? Your job and their job. So you can anticipate what to give them, okay? Or you can think about what's the next thing that I need to do, okay? So in this first role, when you are introducing yourself to the patient, I'm going to be taking it a little bit extra. We don't usually have as much conversation as I'm about to have, but what I want to do is I want you to get into the practice of asking permission before you do something, not just doing something, because sometimes that can be a little off-putting for a patient if you haven't asked them, and then it could also, depending on what you're doing, could result in what? Assault or battery, right? If you're touching them without their permission. So each time before I do something, I'm going to ask Noelle, yep, this one's Noelle, I'm going to ask for her permission, okay? So what I'm going to do today, I'm going to do a Pap smear, and then I'm going to do a pelvic exam, and then I'm going to percuss, and then I'm lastly going to do a breast exam. So let me explain what I'm going to do for each one, and then I'll do it. With the Pap exam, you're going to need the vaginal speculum, whether you're using this one or whether you're using a disposable one. Okay, they're very much similar, as you can see. So this one, depending on, if they want to save money, they might want to use this, and I can dispose of it afterwards. This one is probably a little more cost efficient in the long run because I can sanitize, disinfect, and sterilize this and use it over and over and over again. I'm going to shut the door. So let me just go over a little bit of what this vaginal speculum is and how it works. All right, so one of the things, as you saw in your video, it has a duck bill, but you also want to make sure that you don't open it up too wide and hurt your patient. Now, although you aren't going to necessarily be using this, you're going to be talking to the patient before the doctor gets in there. So you might want to know a little bit about, have they ever had a GYN exam? If they haven't, are they sexually active? Look at the size frame of their body. So I may not want to use one that's really big. I might want to use one that's, really small. Usually there are three sizes: small, medium, and large. This one right here is our small one. I have another one that's medium, and I think I have the big one over there, which is a large, okay? So when I go in, all right, one of the things I want to do is do what? I want to go in sideways, as you saw in the video, right? So it's also, if you think about it, the way the vagina is, where the vagina is, okay? You're going to go in this way and then turn, okay? And then what you're going to do, and I'm going to turn it back this way so you can see. Now you're going to open the duckbill up, and when you do this, the doctor's going to open this up and then he tightens it. But the more you open it, the wider it gets, okay? So what I like to do is I usually just use one hand. So I'm going to go in, sideways turn. I usually put my thumb behind here and get it to where I want, and then just lock it, all right? If you adjust here, so let me close this. If you adjust here and you open this, which I don't want you to do, you're just going to keep this tight. This is what makes it go up and down. So you see, now it's going up and down. So now if I needed to get it even larger, that's what I would do. Okay, so maybe a woman who's, had a number of children, she might have a vaginal speculum that's a little larger. Okay, any questions so far? All right, so many of us who've had a GYN exam, it's kind of hard for us to see, but we're going to have our patient who's going to lay in a supine position, and she's going to scoot her buttocks to the edge of the exam table. And one of the things that we're going to have her do is to put her feet in the stirrups. So this is called what position? Lithotomy. She's in a lithotomy position because she's in stirrups and her buttocks is close to the edge. When we go in, okay, and we open this, sometimes we can just leave it there. You don't realize it, but sometimes the doctor will turn around and they have their other supplies on the table and they've left it, all right? Or they're holding it while they're maneuvering. So it depends on whether the Mayo stand is here or whether their supplies are on the back. But most times you're gonna be in there to assist them. Now, part of what's on the Mayo stand is, again, your 2 vaginal speculums, and this one is your disposable one. So it doesn't have as many features, but it still does what it needs to do, okay? The other thing you're going to have on your tray is your lubricating jelly. Now, the lubricating jelly, you can use it to put it on the vaginal speculum, but you don't necessarily have to. You notice that in the video, they just ran it underwater. Okay, sometimes you want to do that to warm it up because it's a little cold, okay? Or other times we already have it warmed. You will need this when we get to the pelvic exam, because most times we have, not 1, but 2 pair of gloves. One to do our pap and pelvic, and then we also do the rectal exam, okay? They'll do the rectal exam as well. So that's why you have the fecal coat blood card here, fecal coat blood test. So this is a part of it. Today I'm not going to go over that part. I'm just going to go over the pap, pelvic, percussing, and breast exam. So I don't have a thin prep cup, so we're going to act like this is a thin prep. As you saw, with thin prep, this is a newer type of way that we can collect our specimen, because in the past we used this pap kit here, and a lot of times when we were collecting the cells from the cervix, we weren't able to get enough cells, or we couldn't get them to stick on here, and so it didn't give us an accurate result, okay? So it was probably a quantitative as well as a qualitative result, and we want to have a good qualitative and quantitative result. So we're going to pretend like this is our thin prep and we've got solution in here. The other cup would be for what? To tell the patient to void first, right? Because we're going to be testing that as well. So what's in here, let's go over this. We have our cervical spatula. We have our cervical brush, and we have our cervical broom. And it looks just like a broom, like you were sweeping. So it really doesn't matter what order you do this in, but I usually like to use the cervical spatula. You can collect cells from this, but I usually like to use this to get the cells off of the brush and the broom, okay? So the first thing I'm going to do is turn around. Hello, Noelle. My name is Dr. Williams, and I'm going to perform a GYN exam today. Have you ever had a GYN exam? And she would say yes. Let's just say she's going to say yes for everything. Yes. Awesome. Do you have any questions before we begin? No, she doesn't have any questions. Great. Can I verify your first and last name and your date of birth, please? She's verified that I now have the right person. I'm ready to proceed. So I'm going to explain everything that I'm going to do. All right, Miss Noelle, what I'm going to do is I'm going to first start off performing a pap exam. I'll move on to the pelvic, and then I'm going to tap on your stomach, and then I will do a breast exam. But I'm going to explain everything as I go on, okay? Again, do you have any questions? You don't have any questions? All right. So the first thing I'm going to do is I'm just going to put your gown up here and drape and move this back a bit, and so now I can visually see, okay? Sometimes, excuse me, they'll use the lamp. So they'll turn the lamp on, and if I go close enough here and I open this, I want each of you to just take a quick look, and you can see the vagina and you can see the cervix, okay? Can you all see the vagina and cervix? Great.
Oh yeah.
Excellent. Okay. So, as you see, I'm going to pretend like this is the cervix. So the first thing is when I'm going to ask, and I'm going to get to the pom-pom in a minute, when I'm asking for my instrument, I'm going to be going around in a circle because I'm trying to get all the cells around the os. Okay? Does that make sense? Okay. So now let's proceed. So I would have asked her to urinate first, and then I'm going to have, can I have an MA, please, to assist me? Who would like to assist?
I will.
So I need you to put on a pair of gloves. Excuse me. I have Miss Ashley to assist me today with our GYN exam. All right. Hello, Ashley. How are you doing today? Great, great. Could you please hand me the vaginal speculum, the metal?
The metal one?
Mm-hmm. Thank you. Okay. So, just going to move this for a second. So I'm going to go in like this, right? To the side, and then I'm going to turn. And then I'm going to open, tighten, bring this down a little bit. Good. And I can see. I need to open it up a little bit more. Good. All right. And so the key is to make sure that it's not too far in, but in enough to be able to see what you need to see. Okay? So I'm going to move this because I can actually see. I need you to please hand me, Ashley, the pom-pom. Thank you. Okay? So the pom-pom is for what? To get the excess vaginal fluids and secretions from around the cervix. Why? Because I want to make sure that I collect the cells and not excess fluid. So then I'm going to go in and I'm going to try not to touch the sides. I'm going to go around and just move around and say, okay, Miss Noel, how are you doing? All right, I'm just cleaning the area right here. I know this may be a little uncomfortable. Hopefully it's not too cold and I'm going to come out. I'm going to give this to you. Alrighty. And then you're just going to put that to the side there. And then next, can you please hand me the cervical brush? That's the broom. Thank you. Alrighty. So now, I'm going to go in. Alright, I'm just collecting cells, some more cells. How are you doing, Miss Noel? Great. So then now you're going to take this, Ashley, and what you're going to do is you're going to open up this cup. Okay. Always put your lid up.
Okay.
All right, and then you're going to put that in there. We're going to pretend like this is our thin prep. Okay, so you would have solution. Now you're going to take the spatula, and as each time I'm doing another collection, you're going to take the spatula and scrape off the cells off of that brush. So you hold the brush like this. Turn this up like this. There you go. And then scrape the cells off. Good. So the next thing I'm going to need you to do, all right, leave this in here. Always keep it in there because imagine it's liquid in here. All right. I need you to hand me the cervical broom. Thank you. Okay. Miss Noel, you still doing okay? All right. Okay. So I collected the cells. Hand that to you. Okay. And so now I'm done with this. All right. The last thing, the reason why we don't go out the same way we came in is because I now need to, as I'm exiting, I'm making the vaginal speculum bead get smaller, but I'm also looking on the sides. If I were to open this, I'm looking on this side here and this side here. I'm looking at the vaginal walls. I'm looking to see if there's any tearing, any bruising. Maybe I could see a lesion. I mean, I could see anything. So as I'm exiting, I'm going to close this. And what I need you all to do is to look on either side of the vaginal walls to make sure everything's okay. So I've exited. Now I'm going to put this back here on the table. And so we're done with our PAP exam. So again, you want to make sure that you're asking her, is it okay? Is it for her permission? You might want to also tell her it's going to be a little cold. Let me know if it becomes, uncomfortable. Again, you're just trying to communicate. Now that's what the doctor is doing. You as a medical assistant need to be comforting. You have a lot of duties. You need to make sure you're handing the right equipment to the doctor. You need to make sure that you're helping the patient to feel comfortable. And you also need to make sure that you're collecting the cells and doing what you need to do to follow protocol and chain of custody. Are they at me? Okay. All right, so the next thing I'm going to do, I'm going to close this up just for a second, say, all right, Miss Noel, I'm getting ready to perform a pelvic exam. So, Ashley, what I'm going to need you to do is to put a little bit of lubricant jelly. You're going to So, you put that on the end of my fingers. Great. All right. Okay, Miss Noel, what I'm going to do is I'm going to insert 2 fingers, and I'm just going to press on the lower part of your stomach. Let me know if it's uncomfortable. And then so what you're doing is you're doing this. You're pressing against the base and you're palpating, okay? So you're going to insert 2 fingers. All right, you're doing okay, and I'm moving my hand. As I'm moving my fingers to the right, my hand is to the right. You want your whole palm palpating going across. Everything good? Excellent. Okay, we're all done here. So you want to make sure, again, privacy. Cover up, drape her. We're done with this part of the exam. So, if I had 2 pair of gloves on, which is what I would do, but I'm not going to take, so we can save time, I would take those gloves off. Now I'm going to come around to the side, because I've done the pap and I've done the pelvic exam. All right, Miss Noel, is it okay if I pull your robe back? I'm going to place my palm on your stomach, and I'm just going to tap a little bit going around, okay? Of course, she's going to say okay for us. So I'm just going to just robe you right now. And so now you're going to place your palm, and you want to stretch your hand out, okay? Expand your fingers. And the reason why we're doing this percussing, because percussing means what? You're listening to sounds. 2 things. 1, I am listening for bowel sounds. Each of you probably have eaten something earlier this morning or maybe just a little while ago. And so there's different bowel sounds that the doctor is listening for, just to know if maybe there's a sound that shouldn't be there, especially if they've eaten it. You can tell if it's more hollow sound or not hollow sound. So what you're going to do is you're going to take your finger, and it's not tapping like this, like pressing, it's tapping. So it's not pressing, it's not like this, it's like this. So how you do something is also important. So then I'm going to tap on my fingers, and I'm just going to move around, okay, just like that, okay? Move around, and I'm tapping. Again, I'm not pressing, but I'm tapping, okay? Once I'm done with that, now another thing that we can do, and the reason why they're also percussing, is to see if there's what we call rebound tenderness, okay? Rebound tenderness could be something else going on abdominally. Noelle could be pregnant. Of course, I wouldn't be doing this, right? This would be for a normal GYN exam. That exam would be a little bit different if she was pregnant, of course. But for a normal GYN, I'm checking, again, to see what's going on with the vagina, the cervix, collecting the cells. I'm doing a stool, collecting stool. I'm listening for bowel sounds, rebound tenderness. I'm doing everything to make sure that my patient is okay. Because a GYN doctor can not only be your GYN in obstetrics, but they also can be your PCP. And so sometimes they also will catch things early. So now I'm going to put your robe back on. We're all done with that. The next exam I like to do is the breast exam, and that'll be the last one. Is it okay if I move your gown back? Of course, she's going to say yes. So what I'm going to do first is I'm going to lift your arm and put it above your head, okay? There you go. And now I'm going to move her gown back. So when we are doing a breast exam, we want to walk our fingers around, okay? We are not pressing, we are walking. Like that in that old commercial, let your fingers do the walking with Yellow Pages. I know that's way before your time. But you're gonna let your fingers walk around. Now, if I were to do this, if I'm simulating when I'm doing it, I'm going to go all the way around my breast, but I also want to get right here. What's right here that could be kind of tender if I thought somebody was sick? The lymphatic, right? The lymphatic system. So sometimes we're a little tender and sore here because we may have a cold or we may have some infection in our body, and this is a tender spot. So I'm going to start in the most outer part, and I'm going to go close to right where the armpit is, going around the breast, and as I'm moving around, walking my fingers, I'm getting closer and closer to the areolar, which is the color right here before the nipple. Then when I get here, I'm going to look at the areolar to see, maybe sometimes it's indented, it could be something going on with that, and then I'll squeeze the nipple at the very end to see if there's any discharge. So all of that is pretty quick. They'll walk around, walk the fingers around, look at the areolar, squeeze the nipple, everything's good. Thank you so much. You've been great. Noelle, you got to make sure that you put their arm back down. And if you don't have any other questions, this concludes our OBGYN exam. And my MA will finish up with you. If you have any questions, she'll let me know. Okay, and that's it.